Hi there and welcome. I'm Danielle with Family Voices of Wisconsin. And for this learning session, we'll be talking about Medicaid. It's a lot more than healthcare. So even if you've been in the program for a while, hopefully you'll still come away with something new about it that you didn't know before. But my goal here is for you to come away with an understanding of Medicaid and all of the programs that ultimately have their roots in it. So you can make sure you're utilizing the full benefit of this important program. Before we get started, a little about us. Family Voices of Wisconsin is the state affiliate of National Family Voices. We're a small nonprofit, but we've been around a while. This is our 30th year. And all of us on staff are parents of children with special health care needs. So when we share that we've been there and that we understand, well, you can believe that we really do. Our focus is on giving you the information that you need to make informed decisions about what's going to fit best for your family. And we do that through learning sessions, just like this one, our email newsletters, and our online resource library, which is where you can find plain language fact sheets and articles on 70 different topics. So I invite you to check that out. So here's an overview of what we're going to be covering. First, what is Medicaid? And we'll include some background, including how it's funded. Next, we'll talk about eligibility and why you might want to consider enrolling your child. After that, we'll take a dive into what Medicaid covers, including an overview of some of the other programs and services that our families often use that are ultimately rooted in Medicaid. And I'll share how those programs support our kids at home. We're going to explain how your child might use this program to receive medical services and what this might look like for your family. And lastly, we'll go over some of the fine print, including some common things that families encounter, like prior authorizations. So, to get us started, let's make sure we're on the same page about what Medicaid is. Medicaid is a program that provides health coverage to millions of Americans, including eligible low income adults, children, pregnant women, elderly adults, and people with disabilities. Medicaid is administered by states according to some federal requirements and federal rules. It is funded jointly, by the way, by monies from states and from the federal government. First, let's be careful to not use the terms Medicare and Medicaid interchangeably because these are two very different programs. For this video, our focus is on Medicaid, which is a needs-based healthcare program that serves many people across the lifespan, including those of low income, pregnant women, families, children, and the elderly. Medicare is primarily for adults who are age 65 and older, including some younger adults with permanent disabilities. It is a entitlement program, meaning that those 65 plus will automatically qualify. Some fine print here, children with end stage renal disease are also eligible for Medicare. For those of you with kids in their teens or older, by the way, if your young adult receives a notice in the mail about Medicare, contact your ADRC to find out what that means for how they will access health care in the future. But again, for today, to avoid any confusion, our focus is on Medicaid. Funding for Medicaid comes from the federal and state governments working in partnership. The federal government pays each state a portion of the program costs, and each state then adds money and administers the program according to federal rules. Now, there are multiple doorways into Medicaid. Once our kids are eligible through any of these doorways, the health plan that they access is nearly the same. So let's talk about those doorways. There are three different eligibility pathways generally for children that again access that same core Medicaid benefit. Your child can enter through the disability doorway with programs like Katie Beckett Medicaid, or through the income doorway with programs like Badger Care Plus, or your child can receive Medicaid due to disability and income through the Supplemental Security Income or SSI doorway. By the way, SSI is not a Medicaid program, but what it does is it typically provides automatic eligibility for Medicaid in Wisconsin. The Katie Beckett program is one of the entry points to Medicaid for children whose disability meets the requirement of a marked and severe limitation lasting more than a year. An evaluation called a functional screen is used to see if our kids are eligible and if they meet that level of care. Eligibility to Medicaid through Katie Beckett is the only Medicaid program that looks at the child's income and not the whole family's income or assets. In addition, this is commonly the type of Medicaid that families of kids with special health care needs might have in addition to their private insurance. More on that in just a moment. So, Badger Care Plus is the Medicaid health care program for low income Wisconsin residents. Families can apply online anytime. And by the way, if you've applied in the past and did not meet the eligibility guidelines, consider applying again since, well, some of those rules do occasionally change. Once you're enrolled in a Badger Care Plus HMO, you'll get a packet in the mail that's going to explain your HMO, the enrollment process, and will provide contact information. Supplemental Security Income, or SSI, is another doorway to Medicaid. SSI provides a monthly cash benefit for those who are eligible, and SSI uses two standards to decide a child's eligibility, being the degree of disability and the family's income must be below a number that SSI publishes. Both of those criteria must be met for a child to be eligible for SSI. And again, SSI by itself does not provide Medicaid, but SSI eligible children are traditionally also eligible for Wisconsin Medicaid. So let's assume that you applied for Medicaid and you're at the functional screening step. When you're talking with the person doing the functional screen, it's important to be realistic about what comes easily for our kids and about the things that are more difficult. And I'd like to explain why that is. As a parent myself, I get it. We spend a lot of time focusing on the things that our kids can do well and emphasizing their strengths, thinking of things from the perspective of our kids' best day, right? Myself included. However, screening time is when you really want to be candid. Some have said, picture our kids on their hardest day and use that as a frame of reference. And not only is getting the screener right going to be important for eligibility for programs, but if something were to happen to you, sometimes the screen results are used to figure out the kind of care that our kids are going to need if we aren't here to provide it. So just know that sugarcoating their abilities at this step won't help someone new coming into the picture. Okay, Rosie, realistic. A question that you might be asked could sound like, could be, can Ben dress himself independently? Well, can they physically put on clothing? Well, perhaps, But your realistic response might be without me setting out their clothes so that they're appropriate for the weather, they wouldn't have the right things on. Or I can't set out any clothing that has snaps or buttons because he's not able to do those things. Another example on the slide here around communication, I totally get this one. I have a non speaking granddaughter, and I've gotten pretty good at interpreting what she's meaning. But I think it's important for us to remember, especially at this functional screening step, that's not the same as speaking. So by the way, if your screener asks a question that sounds like they're looking for a yes or no answer, but for your child it really isn't, be sure to tell them that and give examples and details to help them understand. It's also true, by the way, that having these kinds of conversations in front of our kids can be really difficult. So just know that if you'd like, when you get to this part of things, it's okay to have your child play in another room with a trusted friend or caregiver so you can speak openly about the things that are hard. So you applied, went through the screening, and your child was found eligible for Medicaid. Now what? Well, let's go over the basics of the services and supports that might be covered to help keep your child living safely at home. So, this is a list of the services provided in the Wisconsin State Medicaid plan as of today. The federal government only requires, by the way, that states offer the items listed here in red for its Medicaid plan. Wisconsin offers much, much more than is federally required, although at any time, of course, that could change. We do hear from families who are often asking the question, I have really great private health insurance. Do I really need Medicaid too? Is there a benefit? And our answer to that is yes. There certainly is a benefit to having both private insurance and Medicaid. There are at least three ways. The first is when you see a provider that accepts your private insurance and Medicaid, the copays and deductibles for your child's care could be picked up by Medicaid, and that can be a big money saver. The second is that if there's something that your private health insurance denies covering, well, that might be something that Medicaid can cover, especially for our kids with higher medical needs. This happens more often than you'd think. So having both in coverages can be really, really helpful there. Another example is that most private plans have limits or limitations or a limit on the number of therapy visits, for example. If you see a provider that accepts both your private insurance and Medicaid, well, Medicaid could begin covering once your private insurance limit is reached. And one more way that having both can be helpful is that Medicaid can often cover some things that most private plans do not, like transportation or diapers or incontinence supplies starting at age 4, and some other things. So let's assume for a moment that you have both private health insurance and Medicaid. What do you need to know about that? Well, first is make sure all of your providers, including any pharmacies or hospitals, make sure they have both insurance cards on file because they can't bill against them if they don't have them. And adding the information on once you've already gotten a bill, well, that can be a little harder to untangle. And here's why. Medicaid is the payer of last resort. So, what does that mean? Well, it means that your private insurance gets first run at paying the bill. It is true that sometimes, in order for Medicaid to cover something, they will ask your private insurance to deny paying the bill first. If that comes up for you, just know that that's common and is a practice, usually that your health provider will handle for you. Okay, back to Medicaid. In addition to traditional health care, here's some of the hidden gems families have told us that they use. Medicaid can pay for items like diapers for children over 4 years old, medical transportation or mileage to medical appointments, coverage for some over the counter medications or other services that a physician may feel are required due to medical necessity. And we'll talk more about each of these things coming up. So I'd like to highlight some specific areas around Medicaid. The coverages can include visits with private or community-based mental health providers. These are county-administered mental health programs. And for children with more complex mental health, behavioral, or substance use needs, they might be involved in a CST or coordinated service teams, which is a wraparound intensive program, or CCS, being a comprehensive community services. And just know that for both of these, family is an important team member when treatment and service plans are being made. If your child has a Medicaid card and you need help getting to their medical appointments, you can contact MTM at least 2 days before the appointment to either set up a ride service or to be approved for gas mileage reimbursement. Now, these services are only meant to be used if you have no other way to get to your child's appointment. So when you call, the person scheduling the ride is going to ask you about this. Allow some extra time on that first time using this service, as much as 2 weeks, in fact, if it's your first time calling. Know that you might be asked for a prior authorization or to allow some extra scheduling time if you live in a more rural community. Our Family Voices fact sheet on non emergency transportation gives even more detail on this important service. Another little known Medicaid benefit is coverage of incontinence supplies starting at our kids at age 4. This could include briefs, which are the diapers that open on each side, or the pull up or pull on type diapers. Additionally, some of the covered supplies under this could include wipes, disposable underpads, liners, disposable gloves, catheters, skin barrier swabs, lubricants, and other related supplies. Wisconsin Medicaid members can order these supplies through J&B Medical Supply. When you call, let them know you're a Medicaid member, have that blue and white forward health card in hand, along with a prescription from your child's physician. And if you have any questions about accessing this benefit, please call Forward Health Member Services at the phone number right there on the slide. It's also that phone number is also on the back of your card. Okay, personal care services allow someone to live well and safely at home, including our kids. Personal care services include services like feeding, toileting, bathing, dressing, light housekeeping, laundry, meal preparation. There are some additional evaluation steps and Medicaid rules for using personal care services. If you think that these would be helpful, the best place to start is your child's primary care provider or a case manager to find available agencies in your area. And then that agency will actually be the one to come in and do a in-home screening to determine your eligibility. Okay. Long-term support programs for kids and for adults are ultimately rooted in Medicaid. So, when we talk about the Children's Long Term Support Program, or CLTS, or the other adult long term care support programs, these are ultimately at their core Medicaid waiver programs. And by waiver, I mean that the usual rules around Medicaid are waived or made flexible to support kids and adults in their communities instead of in a hospital or in a clinic setting. Some of what the CLTS program can provide kids and their families include adaptive aids, home modifications, parent training and education about their care or diagnosis, peer support programs, respite, so caregivers can take that all important break, some specialized equipment, including vehicle modifications that might be needed for some. And by the way, the CLTS program does require the child be Medicaid eligible. Your family may choose respite care as part of your child's long-term support plan. You may have heard of respite care or personal care services, and you may have thought they were the same thing. But again, these are two programs that are actually very different. The main difference is that respite care is meant to give primary caregivers time off from those duties to unwind and recharge. While personal care is like having a helper in your home with you to do some of your child's daily living activities. Some families, by the way, might qualify for both. It really all depends on the care needs of your child. Okay, so we're going to go into the weeds just a little bit to talk about what Medicaid might look like for you. And this matters because if you are in an HMO or not, well, that can affect how you interact with the program and with your healthcare providers. Once you're in Medicaid, there are two paths to using the program. You'll either be using your card as what we call a fee for service, or you'll be enrolled into an HMO or a managed care health plan. Fee for service is a method that pays doctors and other healthcare providers for each service performed, like for tests or for office visits. You show your card, and as long as they're a Medicaid provider, you get the thing. That's it, an abbreviated version. With fee for service, though, there's no set network of providers. Members can generally see any provider who accepts Wisconsin Medicaid. Katie Beckett, by the way, is an example of a fee for service program. Some Medicaid members might be placed in an HMO or in another managed care organization under Medicaid. And managed care is a contract between Wisconsin Medicaid and the HMOs to give comprehensive or all-inclusive services. Managed care, these managed care plans, by the way, are responsible for ensuring access to Medicaid services through their networks of providers. Badger Care Plus members are usually placed in an HMO with that set provider network. This matters and is important for you to know which is the case for you so you can be sure you're going to providers that will accept the type of insurance that you have. Children with special health care needs often need to see specialists, providers who focus on one specific area of health care or a specific treatment. You might need to get a referral from your child's primary care provider before you can see a specialist. Knowing if you are in an HMO or not is really important when it comes to this step. Some fee for service visits might not require a referral, but just about all visits to a specialist when you're in an HMO does need that prior referral from your primary physician. Health Check Other Services is a useful way for your child with Medicaid coverage to access services and supports like mental health services or common over-the-counter things that the doctor might find for our kids to be medically necessary. To get these services, your child's physician often needs to submit a prior authorization through Medicaid to have those things covered. And I'll talk more about that prior authorization step in a moment. For many services in Medicaid, a prior authorization is needed. And of course, this is also true for private insurance. Prior authorizations, though, usually take place behind the scenes, and we don't always know about them unless there's a problem. So, we wanted to explain how this process happens and what you could potentially do if there's a denial. A common reason for denial that bubbles up for families is duplication of services. And this is something that a lot of families and providers stumble on. And this can happen if a child's medical team is billing Medicaid for a service that is similar to what your child is receiving at school. The educational goals and the medical goals have to be different in order for the prior authorization to be approved. And remember that school IEP goals must be educationally necessary, and other therapy goals must be medically necessary. When you're going through this process, too, it can be really helpful to share your child's IEP with their treatment team and vice versa to avoid any overlap. If a Medicaid prior authorization is denied, there's a process that will give you and the health professional the opportunity to explain more, describe it differently, or to clarify the goals of the service. If you're not already in Medicaid but think you might be eligible, start at access.wi.gov. By the way, if you're feeling confident that your child is Katie Beckett Medicaid eligible, after you apply, you should be hearing next from a Katie Beckett eligibility specialist at Wisconsin Department of Health Services. But just know that if your need is urgent, you can proactively reach out to them to move the process along. If your child is already SSI eligible, you can find out if they're also Medicaid eligible. Well, and the answer there is probably yes, by contacting these Social Security offices. That's all I have for you. I hope you found this video helpful. Please visit our events calendar for a time when we'll be presenting this topic live if you'd like, or take a look at our other recorded sessions for more helpful information on a variety of topics. Thank you.